During the COVID-19 pandemic, the role of pharmacy care was extended to include the administration of vaccines and the ordering of some types of tests. As the authorization for those extra services expires, a bipartisan group of lawmakers would like to make them permanent. Joining me to explain is the Senate author of this package, Senator Zach Duckworth. Thanks for being here.
Good to be here. Thank you.
As the smoke is clearing from the pandemic, we are starting to reckon with the pros and cons of pandemic life. One of the pros, according to you, was the expanded role of pharmacists. Why should these offerings become permanent?
Great question, and you're right. We learned a lot of good things and a lot of not so good things as a result of the pandemic. And I think maybe drawing upon my military experience, one of the things that we often do after an operation or some sort of exercise is an after-action review. What went well? What could we have improved? And I think one of the things that we saw occur across the country that worked well, to include here in Minnesota, was the use of our local pharmacies and our pharmacists, so their expertise at those local locations throughout our communities. And so these bills, or one in particular, helps to continue to utilize those local experts in our communities to meet the medical needs of folks all across the state of Minnesota.
The authorization of these services came from what's called the PrEP Act, the Public Readiness and Emergency Preparedness Act of 2020. What happens when that emergency authorization expires?
If and when that expires, we would see a lot of freedom and flexibility that's been afforded to some of our pharmacists across the country kind of revert back to what law had been originally, which means less opportunities or less access for folks to get things like vaccines, immunizations, and other medical services and care that they're currently getting as a result of that act at their local pharmacies.
And so let's walk through the bills. There's three of them. The first one, Senate File 2678, would allow pharmacists to administer drugs through intramuscular and subcutaneous administration. So what does that mean?
Well, I should say I am not a medical professional myself, but the long and short of it is it allows pharmacists, pharmacy interns, and those that are kind of under the supervision of a pharmacist do things like help do placement of medical devices, administer immunizations, shots, administer tests that they might otherwise not be able to do under normal circumstances. So really just affords them the freedom and flexibility to do more, to provide more care and help assist patients versus what they're able to do when that federal law isn't in place.
And based on what some of the people said at the press conference where you talked about this is important, especially in rural Minnesota or places where there is not ready access to a clinic. Is that right?
Yeah, so I live in Lakeville. It's in the South Metro, and you could look in either direction and find all kinds of healthcare providers and places where you can get treatment. That's not true of some places in greater Minnesota where the nearest hospital might be miles and miles away, but your local pharmacy might be much closer. And so if people can get some of the good critical care that they need, especially routine care done locally, why not afford them the ability to do that so they're getting it done regularly, which is good and better for their health, and also it's good for their local pharmacy as well.
The second bill, Senate File 3940, is perhaps a larger departure from the norm. It would allow a pharmacist to order and perform lab tests and administer vaccines. So in terms of lab tests, for example, if I'm pretty sure I have strep throat because I've had strep throat a number of times and I can usually tell, like, okay, I need to go get a strep test. Instead of going to my clinic, I could go to my pharmacist, they would do the test, confirm that I have it, and then write me a prescription?
In theory, that's what we could be moving to. So I've got 3 little kids, and as you can imagine, it's almost a weekly occurrence where one of them might have something, right? Whether it's strep, whether it's an ear infection, whether it's a temperature, you name it. And rather than always having to have folks necessarily go to the doctor's office for a checkup or strep test, something like that, maybe there are ways in which we can use our local pharmacies and our pharmacists to administer some of those tests or answer some of those questions. It'd be a lot more convenient for families as well as other people that are seeking medical care and treatment throughout the state. Really expedite things, make it more convenient, and meet the needs of people.
Now, and to the vaccine part of that, I did get my COVID booster at the pharmacy. That was the easiest, most convenient place to get it. But generally speaking, when I've gotten shots for any reason, boosters, I have gone to my clinic. It is certainly more convenient to go to a pharmacy, but in terms of managing one's health or the health of their children, if you're not going to the doctor, then you maybe, if you're not seeing a doctor regularly, then maybe you don't know that you're missing something. Like, a tetanus. You wouldn't necessarily know that it's time for a tetanus booster. Or can you talk about the vaccine piece? Like, how could we keep track? How would people know without interacting with their doctor that it's time, outside of like a flu shot or something?
Sure, and I think that's a very fair consideration. And I don't want to downplay the importance and the significance of our doctors and our physicians. Obviously, they play a critical role in the care of people all across Minnesota, especially our younger kids as they're growing and developing and getting those sorts of shots and immunizations along the way if they choose to. And so I think I guess I would answer your question by saying this. I would rather have the ability for somebody to get the shots, vaccines, or immunizations that they choose conveniently, rather than potentially not get them at all because it was maybe not as convenient. In terms of tracking, shot records, immunizations, whether that's in consultation or in coordination with their doctors, pharmacists, maybe that's something we need to continue to look at legislatively to see, hey, is there a way that we can maybe close some gaps or fill in some holes that result if we have people getting shots or immunizations here or there. I will tell you this, though, as a kid growing up, as families move, they don't necessarily always have the same doctor or physician that they're going to get their shots from or get their checkups from. And I know some work has been done behind the scenes to try to make it a little bit easier to streamline and share those records, of course, with people's permission, respecting their privacy. So if there are solutions that we can find that help us share that information in a way that patients are comfortable with, that respects their HIPAA privacy rights, then that might be a way that we can help solve that problem as well.
And just a moment on the third bill, Senate File 3823, it would ensure that pharmacists are reimbursed for the services that they provide at the same rate as providers. Why is this important?
So parity for local pharmacists is extremely important, and it gets back to one of the things you brought up earlier, which is in some areas of Minnesota, the local pharmacies are really the only place for people to get to in terms of treatment or care. And we're seeing them close their doors all across Minnesota at an alarming rate. So parity in terms of the compensation that our local pharmacies can get for the treatment and the services and the care that they're providing is absolutely crucial to helping us make sure that their doors stay open so they can take care of and treat the people in their communities.
Now, there's just one other question that I have, and it's about, are you at all concerned if people do end up going to a pharmacist for care as opposed to a doctor? A doctor will have a medical history, but a pharmacist wouldn't. And is there any concern about missing something?
I think there's always a concern about missing something, whether it's a doctor's office or the pharmacist's office. Hopefully the pharmacist is asking questions about medical history and people are sharing that information. I sometimes even have problems recalling my medical history when somebody's asking me those questions. So that's always a concern. But I would go back to my earlier statement, which is I would rather have somebody have the ability, the convenience, the ease of access to care than not have it at all. And hopefully, whether it's in front of a pharmacist, in front of a physician, a doctor, you name it, if they're getting in front of that healthcare, that medical professional and seeking medical attention, they'll get the advice and the care that they need.
You promoted these bills at a press conference with 2 DFL House members. So not only is it bipartisan, it is bicameral. How is it looking to get one or all 3 of these bills into law?
I remain hopeful, especially on at least 2 of them, that they're going to maybe find their way into becoming law this session. There's another, the one that has to do with pharmacy compensation for pharmacists and parity, that might need some additional work. But like you said, it's bipartisan, it's bicameral. People see the importance of this. People know and understand. We're hearing from our constituents how important meeting their health care needs are. And this is a way for both Republicans and Democrats to do this all across the state. So I'm very hopeful that we're going to continue to find success when it comes to this legislation.
Senator Zach Duckworth, thank you.
Thank you so much.